Welcome back to Main Street Living. Well, we are all adapting to a new normal, and that includes wearing masks. But there's been a lot of confusion surrounding masks. Do we wear them? Do we not? Do they really help? Our next guest is an expert on this, and we want to bring in Dr. Josette Gordon-Simet right now, and she's the Chief Medical Officer at Think Whole Person Healthcare. Thanks for being with us today.
Thank you, Cheryl, for the invitation. I appreciate that.
Of course. So I think back to several months ago when the pandemic started, and we were advised not to wear masks unless you were sick because, quote unquote, they don't really help. However, obviously that's changed. Explain the thinking on that.
You bet. And so what we learned here in the United States, looking at other countries globally, we've learned a lot from the experiences in China as well as in Italy. And the one thing that the country of China did that seemed to make a difference was the mandatory use of masks that forced the curve of the continuous increase to begin to decline. And thus, we began adapting that. Unfortunately, we started the continuous use of masks a little later in the game, but certainly was a good thing that we did start it. Unfortunately, as you know, across the country, there were many cities that experienced a surge and a high number of deaths. We have learned lessons since we recognize the impact and significance of this pandemic over the last several months. And so at this point, we are recommending mask use to be continued.
Okay, so I see some places say masks required, others they say masks recommended. So, I mean, what do you say? Are you saying people should wear them all the time, no matter where you are? And I know obviously restaurants, it's going to be hard to do.
Absolutely. So as a medical professional, I will tell you that ethically, I and other medical professionals are committed to the health of our patients and the well-being of our society. And so we definitely recommend maintaining social distancing because we know that the virus is spread through respiratory droplets that can travel several feet. It is important because we know there are several risk factors, health conditions that increases your risk. We know there are asymptomatic individuals who may unknowingly transmit the virus. Actually, in yesterday's New England Journal of Medicine, there was an article describing a potential link between blood types, possibly identifying someone who may be at risk for developing symptoms related to COVID. More to come there, of course, but yes, when you have a chance, New England Journal of Medicine had an article about ABO blood group types, and so that was of interest to me as well. So for businesses who choose to make it mandatory or required, I understand that is a business decision. From a social and public health standpoint, I absolutely recommend masking at all times when out in public spaces.
Yep, that makes sense. And are you allowed to say anything about which blood type might be more susceptible?
You know, I would refer you on to the article. The authors of that article did a really nice job of exploring that. I just found it fascinating, and New England Journal of Medicine has made that publicly available, so you don't need a subscription or anything.
I'm actually making a note of that because it's something I want to check out. Now, here's a question for you. When I wear a mask, I find myself touching my face more than ever because I'm constantly adjusting it. So, I mean, what do people do in this case? There's me on an airplane.
You know, it's best to keep your hands off your face and mouth and eye and nose area in general, because we know that improper hand hygiene can contribute to transmission potentially as well. So what do? If you have to adjust, personally, when my mask starts to slip and I need to adjust, I tend to take it at the bottom of my chin and just sort of try to move it up a little bit. I try truly to stay away from the nose and mouth area.
Gotcha. And before we go, I've got one more question for you. I know some people, have COPD or asthma or maybe bad anxiety where they just can't wear a mask and people might be giving them the side eye in public. So what are these people supposed to do?
Absolutely. That is a tough decision. And because I do not have any of those health conditions myself, but as a practitioner who treats individuals with those conditions, I advise my patients, I know this is uncomfortable. I would encourage you to adjust the times that you need to be out to take care of errands or go to appointments, perhaps making them shorter and less frequent, because we know those individuals with those conditions are absolutely at increased risk for COVID infections and secondary complications related to the infections. I would encourage them strongly to wear it.
Very good advice.
It's for their life. It's for their
Yes.
life.
Absolutely. It's so important. Doctor, I could talk with you all day, but we are out of time. Where should people go to learn more about everything we just talked about?
My favorite site, of course, is cdc.org. You're certainly welcome to contact your usual healthcare provider for current and up-to-date information.
Perfect.
cdc.org, I would absolutely support and recommend.